Hi, thank you for joining me. I'm glad you could be here. Today, we're going to talk about an important topic, which is, can the peripheral nerves really heal? This is something that I get asked a lot, and I wanted to discuss a couple of points with you today. The the answer is yes. So the peripheral nerves do have the capacity for healing and repair. Unlike the central nervous system, which is your brain, and the spinal cord that don't have the ability to regenerate cells, the peripheral nerves do have the ability to heal and repair so long as the underlying nerve cell has not been completely destroyed. So, the worse the problem, the longer it's going to take to bounce back. The older that you are, the longer that it'll take to bounce back. So a 75-year-old man is not going to heal at the same rate as a 22-year-old will. So the longer that you put this off, the older that you get, the more complicating factors that are around, the longer it's going to take to heal. But it can be done. The second part is I want to talk about the power of neuroplasticity. Neuroplasticity refers to how the nervous system adapts to its environment. So, if there's a lesion that's blocking a path, the nervous system figures out a way to go around it, under it, around this way, anywhere to get to the destination point. And as long as you have that ability, you will have the ability to regenerate some peripheral nerve function and bounce back. Again, this has to do with how severe the problem is and how old you are and some other complicating factors. But lost function is something that you want to try to protect and restore as quickly as you possibly can. Then the next thing I want to talk about is the slow and steady rate of growth. This is not about an instant fix. It's not about uh, instant gratification. I know as Americans, we want things 5 minutes ago, and we want it mail order and drive through and all that stuff. But the body doesn't heal that way. The peripheral nerves regenerate at the rate of about 1 inch per month. So to go from your toes all the way up to your spinal cord and your low back is a couple of feet. So it's going to take some time to get those nerves to regenerate, but it will happen. It's just going to take some time and some patience on your end. The first step that we have to do is we want to remove the insult, the something that happened to make the nerves degenerate and break down. Whether it's high blood sugar, whether it's uh, you're not exercising enough, or you have poor circulation, or you have micronutrient deficiencies, or whatever it may be, we have to figure out what those are and put an end to it so you don't continuously make the situation worse and worse and worse. So, by the way, if you find this video interesting and you want some more like it, please help me out with the YouTube algorithm by liking the video, sharing it with a friend, telling a friend about it, and all that stuff. So it really helps me out with the algorithm, and I thank you very much in advance. The next thing we want to do is we want to rebuild the myelin sheath naturally. The myelin sheath is a coating around the nerves that insulate the nerves and make them conduct impulses faster and more and better. And so that has to do with improving your internal environment, making sure you're getting plenty of micronutrients like vitamin B12, which is known as methylcobalamin, activated folate, and essential healthy fatty acids. Those are things that you normally don't associate with the nervous system, but they actually have a profound effect on the function of the nerves, healing and repair. We want to also boost the function of the microcirculation. Every cell in your body needs oxygen. Every cell. And if you deprive a tissue of essential oxygen, you're going to have a medical problem. Whether it's to the your if you deprive the brain oxygen, that's called a stroke. If you deprive the heart oxygen, that's called a heart attack. And if you have deprive the microcirculation to the nerves in your legs or your feet or your arms and hands, then you're going to develop peripheral neuropathy. So we want to try to boost the circulation as much as possible by getting adequate amount of oxygen to those tissues. And we want to try to calm the fire of inflammation. There's two different types of inflammation. There's acute and chronic. Acute is the good type of inflammation, and chronic inflammation is the bad type of the problem. So there are certain micronutrients like alpha lipoic acid and fish oils and an antioxidant-rich diet that can help with that matter. But as you can see, there's a lot of different moving pieces and parts to the equation. So if you have peripheral neuropathy or you suspect that you do, give me a call, make an appointment. Let's figure out what's going on with all these different things. But yes, the peripheral nerves do have the ability to heal and repair to a limited basis. A lot of that is based on how old you are, how bad the problem is, that kind of thing. So once the nerves are so badly damaged that there's nothing that can be done for it, there's nothing that I can do for it or anybody else. It's kind of too late. So uh, get going. Give me a call. Let's make you better. Let's make you healthier. Thank you very much for watching.